Have you ever experienced a sudden, painful muscle spasm? It can be frustrating and even debilitating. These sudden, involuntary muscle contractions are known as muscle cramps or cramps. While they're usually not a serious medical concern, cramps can be extremely painful and can interfere with daily activities and sleep. But what exactly causes these cramps? Are there ways to prevent them from occurring? And when should you seek medical advice for muscle cramps? Join us as we delve into the topic of muscle cramps, exploring their causes, symptoms, and effective home remedies. First, let's start with understanding what muscle cramps are. Muscle cramps are characterized by a sudden, involuntary, and sometimes prolonged contraction of one or more muscles. This can range from a mild tightening sensation to a severe, painful spasm. Cramps often feel like a knot or a pulled muscle and can be localized to a small area or affect larger muscle groups. The affected muscle may feel hard and rigid, and in some cases you may even hear a pop or a snap as the muscle contracts. Now let's explore the various types of muscle cramps. There are several different types of muscle cramps, but they can generally be categorized as exercise cramps, heat cramps, overuse cramps, and pathological cramps. Exercise cramps are the most common type of muscle cramps and typically occur during or after strenuous physical activity. Heat cramps often occur during or after prolonged exposure to high temperatures, such as in hot weather or during saunas or hot tubs. Overuse cramps can result from repetitive strain or overuse of a particular muscle or muscle group, often in occupations or hobbies that require repetitive motions. Pathological cramps, on the other hand, are those that occur due to an underlying medical condition such as nerve or blood vessel disorders, endocrine disorders, nutritional deficiencies, or medication side effects. It's essential to understand the causes of muscle cramps, as it can help in preventing them from happening. Some common causes of muscle cramps include dehydration, electrolyte imbalances, fatigue, muscle overuse, nerve compression, poor blood circulation, and certain medications or medical conditions. Dehydration and electrolyte imbalances are common causes of muscle cramps, particularly during exercise or in hot weather. When you sweat, you lose fluids and electrolytes, such as sodium, potassium, and magnesium. Electrolytes play a crucial role in muscle function, and imbalances can disrupt the electrical signals that control muscle contraction, leading to cramps. Fatigue and muscle overuse can also contribute to cramps, especially during or after strenuous physical activity. Prolonged muscle use can lead to fatigue, which can trigger cramps. Additionally, nerve compression or entrapment can cause localized muscle cramps. Poor blood circulation may result in muscle cramps by reducing the supply of oxygen and nutrients to the muscles. Certain medications and medical conditions such as diabetes, thyroid disorders, and kidney disease can also increase the risk of muscle cramps. If you're experiencing frequent or persistent muscle cramps, it's important to consult a healthcare professional to determine the underlying cause and receive appropriate treatment. Finally, let's discuss some tips on how to relieve muscle cramps. When a muscle cramp occurs, the best course of action is to first try self-care measures, such as stretching or massaging the affected muscle. Applying heat or cold therapy can also help reduce pain and inflammation. Staying hydrated and ensuring adequate electrolyte balance, particularly sodium, potassium, and magnesium levels, is essential in preventing and treating cramps. For persistent or severe cramps, it's important to consult a doctor who may recommend further investigations or treatment options. Muscle cramps are a common musculoskeletal complaint that can affect people of all ages. While they're usually not a serious medical concern, cramps can be painful and disruptive. By understanding the different types of cramps, their causes, and effective home remedies, you can take proactive steps to prevent and alleviate them. So if you experience sudden, painful muscle contractions, consider the tips and advice outlined in this video. Remember to stay hydrated, stretch regularly, and consult a healthcare professional when needed. Together, we can keep our muscles healthy and our bodies moving. Thank you for watching today's video. If you found it informative, please like and share it with your friends. Stay healthy and keep moving. Cramps are a very common occurrence that can affect anyone, anywhere at any time. While they typically aren't cause for concern and resolve on their own, understanding the underlying causes and mechanisms is crucial for effective prevention and timely management. One of the most common causes of cramps is dehydration and electrolyte imbalance. This occurs when the body loses essential minerals like sodium, potassium, calcium, and magnesium through excessive sweating, diarrhea, or not drinking enough water. These minerals play a vital role in muscle function, ensuring proper contraction and relaxation. An imbalance can lead to uncontrolled muscle contractions resulting in cramps. The second cause is muscle strain due to strenuous exercise or physical activity. When muscles are overworked or exercised incorrectly, the muscle fibers become fatigued and overstretched. This strain can temporarily disrupt the nerve signals that control muscle contraction and relaxation, leading to sudden muscle spasms. The third cause is bad posture, or standing or sitting in one position for too long. This can lead to muscle strain and reduced blood circulation, depriving the muscles of essential oxygen and nutrients. Without proper circulation, the muscles become more sensitive to nerve signals, increasing the likelihood of spasms. The fourth cause is age. As we age, muscle mass and strength naturally decrease while the risk of chronic diseases increases. Older adults are more susceptible to cramps, especially at night or after light exercise due to reduced muscle function and blood circulation. Some diseases and health conditions can also increase the risk of cramps. For example, diabetes can cause peripheral nerve damage, leading to abnormal muscle contractions, while kidney failure or liver disease can affect electrolyte balance or muscle function. Certain medications such as diuretics or blood pressure medications can also cause cramps as a side effect by altering electrolyte levels or blood circulation. Understanding the physiological mechanism of cramps is also crucial. Muscles contract when stimulated by motor nerves. Electrical signals from the nerves tell the muscle fibers to contract and relax. However, when there's a problem with these signals, the muscle may contract excessively without relaxing, leading to cramps. While cramps are typically harmless, they can be uncomfortable and even painful. By understanding the various causes and risk factors, you can take proactive steps to prevent them. Stay hydrated, maintain good posture, exercise regularly, and consult a doctor if you have any underlying health conditions. Muscle cramps are a common but often overlooked phenomenon. Recognizing typical symptoms and understanding the diagnostic process is very important, as this helps patients handle them promptly and distinguish between normal physiological cramps and underlying medical conditions. In this video, we'll talk about the symptoms of muscle cramps. The symptoms of muscle cramps can vary depending on the location, severity, and underlying cause. However, some basic symptoms are quite typical, including sudden muscle contraction. Cramps often appear unexpectedly, causing the affected muscle to contract suddenly and uncontrollably. Severe pain. The pain associated with cramps is often sharp, stabbing or strong muscle tension, lasting from a few seconds to a few minutes. The level of pain varies depending on the affected muscle group and the intensity of the spasm. Muscle stiffness. During a cramp, the affected muscle becomes tense, even prominent on the skin surface. Patients have difficulty moving the muscle. Lumpy or bulging sensation. When a cramp occurs, the muscle fibers may bulge, forming a lump under the skin. This is a characteristic symptom that helps distinguish cramps from other common muscle pains. Understanding common locations, timing, and additional symptoms can help patients handle cramps quickly and prevent injuries. Common locations. Cramps can occur in any muscle, but are most common in muscle groups that are under a lot of pressure or are constantly moving. This includes the calf muscles, thighs, quadriceps and hamstrings, foot and toes, and arms and hands. When they appear, cramps can appear in many different situations. Nocturnal cramps usually occur when the body is resting, especially during sleep. The patient may wake up suddenly, feel sharp pain, and have to stretch the muscles to relieve the pain. Night cramps are common in the calves, feet, and thighs. Exercise-associated cramps occur when the muscles are working hard, especially in high-intensity sports. Cramps can occur during exercise or after exercise. Pathological cramps occur abnormally, not related to exercise or posture, often more intense and longer-lasting. Clinical diagnosis. In most cases, muscle cramps can be diagnosed based on medical history and physical examination. Your doctor will usually ask questions such as, how long and how often do cramps occur? Do they occur during exercise, rest, or at night? Where is the affected muscle, and how painful is it? Are there risk factors such as dehydration, overtraining, age, or underlying medical conditions? During the examination, your doctor may observe the muscle spasm, check for pain, swelling, or lumps, and assess the ability to move the muscle. Additional diagnosis. In some cases, especially when cramps are frequent or severe, your doctor may order additional tests or examinations to rule out medical causes. This may include an electrolyte test, kidney and liver function tests, electromyography, or medical imaging. When to be alert. Some warning signs of cramps can be symptoms of serious health problems, including cramps that occur frequently and last for a long time without being related to movement. Cramps accompanied by muscle weakness, numbness, swelling, or redness of the muscles. Cramps that appear in many muscle groups at the same time or throughout the body. Cramps that occur with other symptoms, such as excessive fatigue, severe dehydration, or cardiovascular signs. In these cases, patients should consult a specialist for timely examination and treatment. The interaction between symptoms and causes. Understanding the relationship between symptoms and causes helps determine effective treatment. For example, a mild nighttime cramp often only requires stretching and hydration, while frequent severe cramps with muscle weakness may require electrolyte testing, medication adjustment, or treatment of underlying conditions. Conclusion. Recognizing symptoms and correctly diagnosing cramps is an important step in prompt treatment and prevention of recurrence. Physiological cramps are usually not dangerous, but if they appear abnormally or severely, they can be a warning sign of serious health problems. Paying attention to the clinical features, location, frequency, and severity of pain helps patients and doctors determine the cause and choose the appropriate treatment. Muscle cramps are annoying, painful, and can be debilitating if they happen at the wrong time. So how should we deal with them? How to treat and what to do to prevent them from happening again? Let's find out in this video. Muscle cramps are usually caused by dehydration or electrolyte disturbances. Less commonly, they may be a sign of an underlying medical condition such as thyroid disease, liver or kidney disease, diabetes, peripheral neuropathy, or vascular disease. If you have a cramp, you should first stretch the affected muscle. Hold the stretch position for 15 to 30 seconds. You can also try massaging the cramped muscle. If the pain persists, you can apply a warm compress or take a warm bath. Drinking water or an electrolyte solution such as Gatorade or Pedialyte can also help. In some cases, your doctor may prescribe muscle relaxants or antispasmodic medications to relieve muscle spasms. However, these medications should be used with caution and under medical guidance, as they can cause side effects such as drowsiness, dizziness, and dry mouth. Most cramps resolve on their own within a few minutes. However, some people may experience muscle soreness or stiffness for several hours after a cramp. This is normal and should resolve on its own. However, if the pain persists or the cramps keep coming back, make sure you see your doctor. Here are some things you can do to prevent cramps from coming back. First, continue stretching the affected muscle. This will help the muscle relax and recover more quickly. Drink plenty of fluids to stay hydrated and replace any lost electrolytes. Also, get up and move around every half hour or so to prevent your muscles from getting stiff. And finally, warm up your muscles before exercising and cool down and stretch afterwards. In addition to these tips, there are some things you can do to prevent future cramps. Eat a healthy diet rich in fruits, vegetables, and whole grains. This will ensure that you are getting enough vitamins and minerals to support muscle function. Also, avoid smoking and excessive alcohol consumption, as both can dehydrate you and increase your risk of cramps. Finally, see your doctor regularly for checkups and follow his recommendations for treatment and prevention. Thank you for watching our video today. We hope you found it useful and informative. Don't forget to like and share for more valuable content. Goodbye. Although cramps are not usually dangerous, sudden muscle contractions can be painful and disrupt daily activities. Taking preventive measures and maintaining a healthy lifestyle are effective ways to reduce the risk of cramps. This section will analyze in detail the habits, activities, and nutritional measures that help prevent them in the long term. One of the common causes of cramps is muscle strain or fatigue due to sudden vigorous exercise. Therefore, regular and proper exercise is an important factor. Warm up before exercise. Gentle exercises for 5 to 10 minutes help muscles gradually adapt to vigorous activity. For example, jogging, rotating joints, light stretching. Stretching after exercise helps muscles relax, reduces lactic acid buildup, and prevents cramps. Adjust the appropriate intensity. Avoid overtraining or sudden changes in intensity. Older adults or those new to exercise should start with light exercises, gradually increasing the intensity according to their physical capabilities. Nutritional balance is an important factor in maintaining muscle health and electrolyte balance, thereby reducing the risk of cramps. Potassium. Bananas, sweet potatoes, oranges, and avocados are rich sources of potassium, which helps muscles contract normally. Magnesium. Almonds, cashews, lentils, and green leafy vegetables provide essential magnesium. Calcium. Milk, yogurt, broccoli, and salmon help muscles contract effectively. Sodium. Helps maintain body fluid balance, especially when exercising a lot or sweating. Drink enough water. Helps the body maintain osmotic pressure and limit electrolyte loss. Filtered water, fruit juice, or electrolyte solutions are suitable choices. People who exercise a lot or work in hot environments need to pay attention to regularly replenishing water and minerals to avoid electrolyte imbalance, the main cause of cramps. Maintaining correct posture when working and resting is also an important factor to avoid muscle tension and cramps. When sitting at work, make sure your feet are flat on the floor, your back is straight. Avoid bending your legs for too long. When standing for a long time, take breaks, walk gently, or stretch your muscles. When sleeping, avoid bending your legs or stretching your muscles too much. You can use a leg support pillow to keep your muscles relaxed. These simple habits help increase blood circulation, provide oxygen and nutrients to your muscles, thereby reducing the risk of cramps. In addition to good posture, stretching exercises in the evening or before bed can help reduce the risk of cramps, especially at night. Calf stretch. Sit up straight, stretch your legs, pull your toes towards your body. Hold for 15-30 seconds, repeat 2-3 times. Front thigh stretch, stand up straight, pull your heels up to your buttocks, hold the stretch for 20 seconds. Ankle rotation. Rotate clockwise and counterclockwise, helping blood circulation in the legs better. Doing these exercises every day helps keep your muscles flexible and reduces the risk of sudden cramps. Finally, you should pay attention to controlling your weight and living a healthy lifestyle because being overweight increases the load on the legs and reduces flexibility. Simple, healthy lifestyle changes can make a big difference. Limit alcohol and caffeine. Both of these substances can cause dehydration and electrolyte disturbances, leading to abnormal muscle contractions. Get enough sleep. Lack of sleep makes muscles tired and more sensitive to cramps. A healthy lifestyle helps muscles work effectively, increases reflexes, and reduces the risk of cramps. When to see a doctor. Although cramps are usually not dangerous, in some cases, a medical examination is necessary. Cramps appear frequently, are severe or prolonged, and are not related to movement. Cramps are accompanied by muscle weakness, numbness, swelling, or redness. Cramps appear in many muscle groups at the same time or throughout the body. Cramps seriously affect sleep, daily activities, or mobility. Your doctor may order electrolyte tests, kidney function tests, electromyography, or medical imaging to find the cause and recommend appropriate prevention or treatment methods. If you liked this video, please leave a comment below and subscribe for more videos like this. Thank you for watching. See you next time.